There is a technique that can reduce your stress in under 1 minute. This is a breathing technique that your body already knows how to do naturally, and that neuroscientists have studied and confirmed that it rapidly lowers stress and regulates your nervous system, sometimes in only 30 seconds. Are you interested? Do you want to know more? Well, you're in the right place. So welcome to the Holistic Therapy Revolution, where we are aligning mind, body, and soul when talk sometimes just isn't enough, and sometimes it just isn't enough. Insight does not always create transformation, and treating the whole body experience gets us better transformative results. So, I'm Beth Miller. I'm a holistic psychotherapist, and I am the creator of the Advanced Holistic Counseling and Coaching Model. And I do believe that using modern, inspiring holistic therapy is the way that we actually heal and thrive forward more efficiently and more completely in the 21st century. And today we're talking about the physiological sigh. Now, this is one of the most efficient science-based tools for calming anxiety and downshifting the stress response that we have, and it is extraordinarily effective. So if you do not want to hear a little bit about the science behind the physiological sigh that I will be sharing briefly, you can just follow in the show notes where I actually do the practice of it, and I will do it with you, and you could just jump right there if you want to just jump right in to the physiological sigh. So here's why fast regulation matters. So in some earlier episodes of the Holistic Therapy Revolution, we talked about how once a stress response begins, that adrenaline has now already dumped into the bloodstream, and that you cannot think your way out of adrenaline, right? You have to meet physiology with physiology. You must shift your physiology first in order to dramatically change an anxiety attack or a really strong stress response, because you have already been activated physiologically. But here's the thing. Sometimes you don't have 5 minutes, right? You don't have 5 minutes to go regulate your system. Sometimes your anxiety spikes in a meeting. Sometimes right before a presentation. Sometimes while you're driving. Sometimes when you're about to go out onto the sports field. Sometimes in the middle of a difficult conversation. And you need something faster and more immediate. And that's where the physiological sigh comes in. And to be honest, why would you ever want to be in a stress state or an anxiety state for longer than a couple of minutes if this could be something that works for you? So, what is the physiological sigh? So, the physiological sigh is a specific breathing pattern, and it involves one deep inhale through the nose, followed by a second short inhale through the nose, and then a long, slow exhale out through the mouth. That's it. It's not complicated. It's easy. It's free. No side effects. But let me go through it again. The physiological sigh is a breathing pattern where you do one deep inhale and then a short inhale. Both of those are through the nose, by the way. And then a long exhale out through the mouth. Right? You inhale deeply, you top it off with a second small inhale in through the nose, and then a slow extended exhale. Now, this pattern occurs naturally in humans, especially in moments of relief or right before sleep. And it's something that your nervous system already knows how to do. So that makes it even easier to use, right? So here's the science behind it. The neuroscience research, including the work that was popularized by Andrew Huberman on the Andrew Huberman Lab, has shown that the physiological sigh is one of the fastest ways to reduce acute stress. And here's why it works. When we are anxious, carbon dioxide levels in the bloodstream can become dysregulated due to the rapid, shallow breathing that we have when we're stressed. When we do the double inhale of the physiological sigh, meaning we breathe in, one long inhale in through the nose, and then another short inhale through the nose, what's happening is that we are breathing in a lot of oxygen. And we are allowing that oxygen to fully inflate the tiny air sacs in the lungs called the alveoli. This oxygen exchange is very soothing to our system. And then this long exhale, where we breathe out through the mouth, is a slow exhalation that is reducing the carbon dioxide. And that activates the parasympathetic nervous system through the vagus nerve as well. This is also slowing your heart rate. It's reducing your stress response, or what's called the sympathetic activation. And it signals to the brain that the threat has passed. And when the brain receives that signal, the stress chemistry begins to decrease in your body. Adrenaline metabolizes, cortisol begins to fall, and the body stabilizes. And this is all through one breath pattern. So you're onboarding oxygen, and then you're offloading carbon dioxide. And that process is incredibly relaxing to our system. So let's practice together. So here's the physiological sigh process. I'm going to do it. I'd love for you to do it with me right now, because the more experiential our practices can be together, the more likely you'll have this in your toolbox to be able to use later. You could teach it to a client. You could teach it to your child. You could use it yourself when you're in the car and you're in traffic. So here we go. I'd like you to sit comfortably, but of course, wherever you're sitting is going to be perfectly fine for the physiological sigh. And you're going to first inhale deeply through your nose, and then you're going to take a second short inhale through the nose, and then you're going to do a nice long exhale out through the mouth. Are you ready? Do it with me now. What you're hearing me do is take a deep inhale in through the nose, and then a short extra inhale through the nose, and then a nice long exhale out through the mouth. I'll do it one more time. Do it with me. All right. Now, you might even take stock for a moment and just say, hey, did anything shift inside of me? Just check yourself out. We only did it 2 or 3 times, but the truth is that the physiological sigh, the science says that sometimes we may only need 2 to 3 times of doing that breath to start experiencing a difference. Our muscles might start to soften, our heart rate might begin to slow, our thoughts may become less urgent, because this is our physiology changing in real time. If you did not notice a significant shift in 2 to 3 times when we were just practicing, it's no big deal. What some people do is they do about 3 minutes of what's called cycle sighing, or the physiological sigh cycling, doing that same motion of a long inhale, then a second short inhale, both through the nose, and then a long exhale out through the mouth for about 3 minutes. And people report getting great results from that too. So let's talk about why the physiological sigh is just such a great tool for our toolbox here. One, it's really simple. And it's powerful because it works at the level of the nervous system. And it aligns your mind and body by stabilizing the breath, which stabilizes the heart, which stabilizes the brain. So we're getting a lot done in such a small movement, a small action. And when the brain is no longer in survival mode because it just calmed down, now your soul, your higher awareness, your grounded self, your energy can reemerge. You can feel more connected to self-actualization. You can feel more like who you really are when you're not stressed, when your body feels safe and secure. And this is why in holistic therapy, we don't just focus on insight. We regulate our bodies. We find the ways to be able to expand our energy. We connect with our soul. And we work with the mind, right? So here's some ideas about when to use the physiological sigh. Please use it at the first sign of anxiety. Why not, right? Why not just jump right in there when you're having the first signs of stress or anxiety? Please use it before difficult conversations. Please use it before public speaking. Please use it when you're emotionally overwhelmed. Please use it before sleep. Please use it anytime you feel activated. And please use it after you've had activating circumstances in order to be able to help yourself re-regulate your whole body and your mind. It's portable, it's free, it's biologically intelligent, it's already built into you, and it's as holistic as tools come. So if you notice any stress or anxiety this week, which I hope it won't, but it might, don't immediately just argue with your thoughts. Instead, take 2 to 3 physiological sighs. Maybe even do 3 minutes of the cycle sigh. Let your body settle down. Then decide what you think or what your actions and behaviors are going to be. Because when talk isn't enough, we need to use the other parts of our system in order to bring us back into alignment. I'd like to thank you for being here. I'd like to thank you for all of your curiosity that you bring to the holistic therapy revolution. And I'd like to thank you for being a huge part of the holistic therapy revolution with me, Beth Miller. Have an awesome day.